Hey guys, so I decided that I wanted to talk to you about the other problem that I have. As of July, it's still not diagnosed, and my accident happens in 2009. If you haven't watched my PTSD video, I'll give you a little insight into what happens. Basically, I got hit by an older gentleman who was drinking, and he was on the way to the next bar, and he had a very large truck, and he hit me while I was stopped at a red light. We were coming off the interstate, and he just was in a hurry to go drink more. And basically what had happened was I had my arm across the steering wheel. I was making sure that the guy wasn't going to run the red light that was coming through. And he slammed into me, and the impact of his truck hitting the back of my car, my body pushing a little bit forward that it did, with my wrists pretty much, I guess, at 11 on my car steering wheel, really did a number on my shoulder, my back, my neck were all affected by it. And I didn't realize until the next day I started feeling symptoms, and I thought that I had just slept funny. And then when it didn't wear off like normal, aches and pains from sleeping in a funny position did, I decided that I needed to go to seek medical advice, and that was also what my insurance told me as well. They turned me to an orthopedic, and I had to do physical therapy. I was at the point where I couldn't move on my own for, I want to say, a good 2 weeks. I couldn't even get up off of a chair, off the couch by myself. I couldn't sit down half the time by myself. I was really lucky that my boyfriend stood by me and helped me through, everything he's helped me through. When I went to physical therapy, they had thought that they had worked pretty much everything they could. And I did physical therapy for a few months. And then I was given the option of experimental surgery or a cortisone shot, or giving it time and just seeing, if the pain subsides, because it was so traumatic that I did have a lot of swelling in it. I am not a fan of experimental surgery. If you're going to do surgery on me, you better have a damn good reason, and you better know what you're doing. If not, I want no part of that, because anything could go wrong. And the cortisone shot, I just wasn't, at that point, I wasn't ready to do it. I proceeded to still do a little bit more physical therapy. I was still seeing my doctor. I want to say 6 months, where they didn't want me to do any physical work. They didn't want me to do any desk work. Pretty much my job was to lay around the house. They gave me exercises to do, to get my strength up, to get my range of motion, which is basically how far you can move your arm straight up to the side without having any assistance, without having any pain. I ended up getting a job where I was required to be back and forth between my, being on my feet and sitting at a desk and doing a lot of computer entry work. And sometimes equipment would be faulty, and I'd have to move it. Then I was working, I couldn't even move. I could not get up out of the chair to go get customers. And that was part of, that was a major requirement in my job. And so my boss at the time had come in and told me, go home, go see a doctor. And so I did. And that's when they saw that it was a relapse. They gave me more physical therapy. So it was hard but I still made it through the physical therapy, and then we got to the point where I realized physical therapy was only making it worse. I was having more pain than I should have been, and that was the other part, was that we didn't know what the problem was. So then I was given, well, here's our situation. We can give you a cortisone shot and see if it works, or we can go in for experimental surgery. And so I was forced to take the cortisone shot. And some people, there are a lot of people out there who have taken the cortisone shot and it has worked for them. And thumbs up, you get a cookie. I was not one of them. It was horrible. It was the worst thing ever. It was the most painful injection, and I actually got it in my shoulder, if you can see it right here. I got it in my shoulder, and it was the most painful, godforsaken thing I've ever had, and I will never do it again. I could not move for like a week at least on my own. Couldn't hardly do anything. And it was, recovering and realizing, hey, this shot's not working, this shot's not doing anything. I'm still having trouble. And, I can't go to the grocery store by myself because I can't pick up groceries just to put them in a cart, and I can't push the cart around the grocery store because my shoulder and my back won't do it. I have had plenty of times where, I can't wash my hair one day because I'm just in excruciating pain. Brushing my hair, I wake up and think I'm feeling fine that day, pain's not that bad, and just go to brush my hair or even flip my hair out of my face, and all of a sudden it's just retching, tearing pain in my shoulder. Seeing as the cortisone shots didn't work and I'm still having all of these issues, they decided to give me an arthrogram MRI. And an arthrogram is basically where they put you on a table, lying down, and they have a machine above you, above whatever portion of the body that you need to have this arthrogram done with. And they turn on the x-ray machine and they put needles directly into, in my case it was directly into my joint, so it was in the joint in my shoulder. And I got 3 injections. The first one was local anesthesia. The second one was a second cortisone shot, which my doctor still wanted me to take. And the third one was the dye. And basically what they do is they put dye in your system, and then they can see if there's any tears or scratches or anything that might not have showed up before. And so I got my MRI, and I was feeling fine. It was perfectly fine. I'm like, man, I didn't feel anything, and I feel good. It's a little shaky, but I'm used to just sometimes, my right arm will just shake. This was like my whole upper body was shaking too, and I was like, oh, you're probably just still recovering from being in the tube for the MRI. And we didn't think anything of it. We went to dinner hours later, I think at least 4 or 5 hours later, and the pain started getting to me. And it was decently terrible, and pretty much went to bed, woke up the next morning, and I had Saturday classes for my college, and went to my class, came home, laid down because I was exhausted, and took a nap for an hour, woke up, and I could not move. I pretty much was on the couch for an entire week. With that, I had no signs of any tears. I didn't have anything that they could do surgery on, that they could work with. They didn't know what else they could do for me because the cortisone shots weren't working, and they didn't see the need to operate. Then that meant that they couldn't do any more for me. I was dismissed as their patient, and I was off to find a different doctor. And it's not easy to find doctors when you don't know you don't know what you need. You don't have a primary care physician, and you live in a state where you're not really familiar with doctors in general. And so that's pretty much what I'm stuck with. I went to a pain management doctor. I was actually dismissed from my orthopedic last September and started with a pain management doctor. Basically, I'm at this point where I want to find out what's wrong with me. I want the tests done. I don't want to take experimental medicine after experimental medicine after experimental medicine to see what is going to work for me. I want to see what is wrong with me. And so that's what I'm doing. And trying to find a doctor, trying to find somebody who's capable of doing the things I need. There's only so much that you can deal with being in pain. And I can walk around like a perfectly capable human being and look just like nothing is wrong with me. But every moment that I'm awake, I am in severe pain. I have gone sleepless nights because of this. Don't forget to thumbs up if you like the video. Leave me a comment if you have any questions. Go ahead and leave them below. And don't forget to subscribe. I will keep making videos, and I have several different channels. I'll link them below. Alright, and I hope to see you guys soon. Bye.